Hi, this is Tony with StuffSeniorsNeed.com, and I am coming to you today with a video regarding the Medicare donut hole. Now, the Medicare donut hole is the difference between what your standard insurance would cover through Medicare Part D for your medications and the point where seniors enter what is known as the catastrophic coverage threshold. Now, I'm going to do my very best to explain this process in as simple a manner as possible, because as usual, our government has taken what could be a simple process and made it as complex as humanly possible. And then I'm also going to give you some tips and techniques and ideas on how you can avoid paying too much for your prescription drug coverage and how you can avoid the donut hole. First, once you make your decision on which Medicare Part D plan you're going to join, again, that's the prescription drug coverage, okay, you're going to have to pay an initial deductible for your medications. This varies from year to year and company to company, but right now the average is about $310. Now, while you're being covered in this initial phase, the Medicare donut hole is not an issue for you. Okay, just keep making your co-payments as is required, and everything will be fine. This initial coverage period, although it's going to last until through your deductible and what the insurance company lays out. The number right now is $2,840 for your prescription drugs. Okay, now this number changes from year to year and also as the government tweaks the program, so you're going to need to keep up to date on what the number is when you're watching this. But right now, that's the threshold number you need to be concerned with, $2,840. Because once you hit this limit, that's when the problems begin. You are considered to be in the donut hole. This means you have to pay the full cost of your medications until your total out-of-pocket expenses reaches $4,550. And once again, this number changes from year to year. Now, once you hit that limit of $4,550, the donut hole ends and you enter that catastrophic coverage limit where the Part D plan will pay your prescription drugs for the remainder of the year. This is probably the biggest misconception. Most seniors that have either emailed me or I've spoken with think once they hit this limit, it is forever that they have to pay this very small amount for their drugs, and that is not the case. It is only until the end of the year. At that point in time, you wind up hitting the reset button, and then on January 1st, this entire process starts over. So you have the initial phase up until $2,840. At that point, the donut hole commences until $4,550, the amount of money you're laying out. So that's the way the donut hole works. And remember, it's only through the rest of the year. Okay? That means that this dealing with the donut hole is an annual event until you can come up with some ways to avoid the coverage gap. And now this is what I'm going to talk to you about, because this is about lowering the cost of your prescription drugs so that you can either delay or completely avoid that donut hole. The first tip I have for you is to start using generic drugs or alternatives from your doctor. Now, generic drugs are just as safe, just as effective, and are tested just as rigorously by the FDA as their brand name alternatives. This isn't me saying this. You can check this out through the FDA. That means if there is a cheaper drug available that will do the same thing as the brand name drug, take it. This is going to lower your cost, your insurance company's cost, and it's going to delay the onset of the donut hole. I would also talk to your doctor about seeing if they can prescribe lower cost medications. And they're going to definitely be in tune with that and understand why you're asking that. Next, I want you to check to see if your state has a pharmaceutical assistance program. Now, at one time, all states had them. Okay, but in 2006, when the federal government took over the prescription drug benefit, when Medicare Part D was created, okay, a lot of the states terminated their plans. Right now, there are 23 states that currently still have a pharmaceutical assistance program. All you need to do is do this Google search for Medicare SPAP. The first result will be for the Medicare page, which will list the 23 states that at least currently have the program. Where I live in New York, they still have it. It's known as EPIC, the Elderly Pharmaceutical Insurance Program or Insurance Corporation. But that will provide you with additional benefits in those states if they have the Pharmaceutical Assistance Program. Next, take a look into private prescription drug assistance programs. Okay, these are cases where the manufacturers of the medications will assist low-income individuals based upon eligibility requirements, okay, to see if they can get their drugs either for free or at least at a reduced cost. Now, just as an example, as I was doing research for this, I did a quick Google search for Lipitor Prescription Drug Assistance Program, and I found a website called RX Assist. They have a comprehensive listing of all of these prescription drug assistance programs where you can either get free or extremely low-cost medications if you qualify as a low-income individual, and that's going to enable you to help to avoid the donut hole. Next, take a look at national and charitable foundations. The best place to look is right here, benefitscheckup.org. Once again, you're going to find all types of government assistance. I mean, not only in help for paying for food, but also with assistance with your prescription drug benefits. Next, Medicare Extra Help. If you currently have Medicare, and I'm guessing that if you're watching this, you do, and you know, we're talking about Part D plans, you should have Medicare, you can apply for Medicare Extra Help. Now, this is a special program, okay, for those who are low income and have difficulty paying for their prescription drug benefits. So if you were just to, you know, do a search for Medicare Extra Help, at that point in time, they would walk you through the process to see whether or not you qualify. And then finally, this might be some advice that you weren't expecting or maybe didn't want to hear, but I'm going to tell you right now, for those people that are out there on medication, I have found, and this is from my own personal experience, because about 4 or 5 years ago, I lost 60 pounds. The improvement in my health was phenomenal. So if you decide to take a proactive approach to your health and make the effort to lose weight, I have found that you will be able to either reduce or completely eliminate many of the medications that you are currently taking. You definitely need to do this under a doctor's care, but if you were to take those types of proactive steps, okay, if you're physically able to do so, I am going to tell you right now, you will be able to immeasurably lower the amount of medications that you're currently taking. So I cannot recommend enough a program of diet and exercise under a doctor's care, and that will definitely enable you to improve your health, lose weight, and you will definitely reduce the amount of medications that you need to take. So I hope this helped about the donut hole, explaining it, and also some of the tips and ideas to reduce your prescription drug costs. This is Tony with Stuff Seniors Need, and I will see you next time. Take care.